Very good morning. Thank you for joining us here at the UN office at Geneva for this press briefing today, the 13th of February. We have, as usual, quite a number of briefers on today's agenda. Before we turn to our first briefer, I just wanted to note that we sent out about 15 minutes ago a short announcement to indicate that Philippe Lazzarini, the Commissioner General of UNRWA, will deliver a few remarks to the media at the end of his executive briefing to member states outside of room 7, or just above us, in fact, at approximately 11:30. I know that many of you are interested in hearing what Mr. Lazzarini has to say. We'll try to wrap up this briefing in time, but I just wanted to flag that at the onset of this briefing. Without further ado, I'd like to turn now to our colleague from the World Health Organization, Mr. Peter Graf, who's acting WHO representative to Sudan, who's joined us from Cairo. Christian, I don't know if you wanted to add something beforehand. Okay, I take that silence as that we can turn immediately to you, Mr. Graf. So thank you again for joining us on this very important subject. Over to you.
Thanks a lot, and thanks for everybody for showing up and joining online. So I'm joining you now from Cairo, after having had the field trips to Chad, South Sudan, Nairobi, coming from Port Sudan, of course, previously. So 10 months have passed now since the escalation in the conflict started in April 2023. And we see a continuing deterioration of the humanitarian situation. It's now the world's largest displacement crisis, with 8 million people displaced, of which more than 6 million internally and almost 2 million in neighboring countries. And during my recent missions to Chad and South Sudan, I've seen the difficult conditions people are facing, who are fleeing the crisis, who are fleeing the violence. In most cases, these are women and children. They're living in overcrowded areas with limited access to safe water, food, and life-saving basic health services. About half of all the Sudanese need humanitarian assistance. The 2024 Humanitarian Needs and Response Plan for Sudan plans to target nearly 15 out of those 25 million people. And for the health response, we're only targeting a third due to limited access and to the limited availability of resources. There is a particular concern that the upcoming lean season will lead to catastrophic levels of hunger. We already see that every 7th child under the age of 5 is malnourished, that more than 700,000 children are facing severe hunger, and that already over 100,000 are suffering from severe acute malnutrition. We all know that hunger weakens the body's defenses. It opens the door to disease and increases morbidity and mortality. Disease and malnutrition have an unhealthy synergistic relationship. Malnourished people, particularly pregnant women and children, experience worse outcomes of disease. Malnourished children are at an increased risk of dying from illnesses like diarrhea, pneumonia, and measles, and this especially in settings where they lack access to life-saving health services. So the situation in Sudan is a perfect storm because the health system itself is hardly functional. The child immunization program is breaking down and infectious diseases are spreading, with since the onset of the crisis over 10,000 cases of cholera reported, 5,000 cases of measles, about 8,000 cases of dengue, and well over 1 million cases, clinical cases of malaria. The insecurity, as well as bureaucratic hurdles, continue to impede humanitarian access, and the most vulnerable populations reside in areas that are either hard to reach or are actually inaccessible at the moment. For example, previously safe areas such as Wad Madani are now the people of Sudan are facing a life or death situation due to the continued violence, the insecurity, and limited access to essential health services. And there seems to be little hope for a political solution in sight. WHO is working to scale up and expand its response to the humanitarian crisis, focusing on delivering essential life-saving health services and outbreak prevention and control. We are also working to establish and expand cross-border operations to further support the delivery of essential medicines and supplies to reach our implementing partners working in the difficult areas, such as Darfur and the Kordofans. As we speak, our teams are delivering 58 metric tons of medical supplies to Darfur, and these include emergency health supplies, supplies for the management of chronic diseases, injuries, and emergency surgery. So this delivery itself, which is, given the scale of the crisis, a drop in the ocean, nevertheless, we will be able to deliver 30,000 treatment courses for non-communicable diseases and primary healthcare supplies to cover the needs for 300,000 people for the next 3 months. In total, WHO has delivered some 1,750 metric tons of supply to Sudan since the crisis started. But there's so much more that can be done than what we're doing right now. And for this, we need the international community's commitment, including strong advocacy for unhindered access to humanitarian partners, as well as the financial resources to rapidly scale up the response in Sudan. The need is huge, but so is our commitment and resolve. Back to you, please.
Thank you very much, Mr. Graf. Indeed, the need is huge and there's much more we can do. Are there questions for Mr. Graf? We have a question for you, Mr. Graf, from Lisa Schlein of Voice of America. Lisa.
Thanks, Rolando. Good morning, Dr. Graf. I'd like to, do you have any figures on the numbers of people who have died from diseases and more particularly the children who are severely malnourished, how many have died and what the prospect of saving their lives are? I mean, what you talk about a perfect storm. Well, how far is this going to go? What can we expect to see from this horrible situation? And then I gather from what you say that Martin Griffiths had said that he was had spoken to the commanders of the rival generals about negotiating humanitarian access. I guess nothing has come of that. Could you perhaps discuss that a bit? Thank you.
Okay. Thanks, Lisa. So on the first one, when it comes to overall figures, I would have to come back to you. But let me give a very specific example of what is happening right now. And you may have heard about this already. MSF recently did a preliminary assessment of the effect of hunger on disease and mortality in Zamzam refugee camp in northern Darfur. So we're talking about a population that actually we don't really know the size, but it's probably between 400 and 500,000 people. And we already see dramatic increase in excess mortality amongst children. What we know is that we have an enormous cohort of children that is not immunized, that the partners on the ground, in this case MSF, do not have the means to bring in the vaccines to start a catch-up campaign for immunization. And that we are now in discussion with them that we as WHO will help set up the cold chain to get them those supplies. Because if the predictions are correct, that with the lean season, the level of hunger is going up, we will end up with a very large number of children and mothers who are malnourished, who are not protected from disease, and who do not have access to basic services. So that's basically my message, is that we can reach them now. We are starting to expand our cross-border operations quite strongly, but we need to get the continued support from our partners to be able to continue with that. Now, on the let's say the humanitarian access, my feeling is that especially from Chad, the level of cross-border operations can now slowly start to expand. But what of course we collectively would really want is that we could start working cross-line between the two warring factions, and that unfortunately is at this moment still extremely sporadic without a clear commitment from both sides. Back to you.
Thank you very much, Mr. Graf, for the questions on Sudan. Lisa, do you have a follow-up?
No, I don't. I actually want to ask you something, Rolando, and I'll wait to see if anyone has a follow-up for Mr. Graf.
Okay, are there questions for Mr. Graf? Further questions? No, I don't see that's the case. Mr. Graf, I'd like to thank you very, very much for joining us and keep up the important work that you're doing. Thank you so much. And please feel free to join us at the briefing anytime. Christian, I'm not sure if you had anything to add. If so, just raise your hand. Otherwise, we'll move on to, well, let's take your question. Lisa, this is on Sudan to me?
Not on Sudan, but I imagine other people who are on Zoom who may not be able to get to Mr. Lazarini's remarks would be very interested in having them. So my question is, will they be recorded and sent to us, please? Thank you.
We will have a camera in the room and we'll do our best to share that continuity with you along with the statement. Let's just see, after this briefing, I'll go up there myself and see what we can do to ensure that, okay? Thanks for the question. Maybe just back to Sudan, I should mention that as the Secretary General mentioned last week, he plans to attend the African Union Summit next week. In fact, he'll be traveling this weekend. One moment, where's my note? He'll be traveling to Addis to attend the summit. That's this Saturday, the 17th. And he'll be holding a press conference in the afternoon, Saturday, this coming Saturday, the 17th of February. And Sudan is going to be, of course, very prominently fixed on the agenda. Members of the International Intergovernmental Authority on Development, IGAD, and African Union with the Arab League will all be present. So very much Sudan will be discussed at that meeting this weekend. Catherine France-24. Is this for me or for Mr. Graf?
Yes, good morning, Rolando. Thank you for giving me the floor. 2 points. The first, it would be highly appreciated if we could get as soon as possible the notes of Dr. Graf. I think that everybody understands that it is really helpful for the correspondents to get the notes as possible in advance, so like that we can cover the different topics. My second, it's not a question, Rolando, it's regarding Mr. Lazzarini. I mean, I think that all correspondents would also appreciate to have access, as Lisa said, to the people that are making the news. Gaza is in the news, and it would have been nice to have a real press briefing, hybrid press briefing, in order for all the correspondents to cover and to ask questions to Mr. Lazzarini. Same for other stories. People that are involved are often in Geneva and they're not meeting the press. I mean, if we want to work properly, it would be really nice if we could have access to all these experts. Thank you, Roland.
Thank you very much, Catherine. I take your points, and just to note that, as I mentioned, we will share the video, and if there is a written statement, well, of course, we'll share that with you. He's not taking questions, I understand, so of course, we do our best to try to get key speakers such as Mr. Lazzarini, who is obviously very sought after, to speak to the media. That's why we arranged at least this. And as you note yesterday, we also shared with you a link to his press conference in Brussels, which I know was widely picked up. But of course, we'll do our best, we'll continue to do our best to ensure that we can at least organize some sort of monthly press for you. And we'll share those comments with you afterwards. I think we'll move on to the next subject in that case. And I'd like to ask Liz Throssell of the Office of the High Commissioner for Human Rights to join me here in the podium. Liz has 3 subjects to brief on: Syria, Senegal, and business and human rights. So let Liz get settled in, and she'll start off with Syria, I think.
put out a press release and report on Syria, and this is really what the report is about. Many Syrians who had fled the war face gross human rights violations and abuses upon their return to Syria, according to a report released today by the UN Human Rights Office. The documented violations and abuses have been perpetrated by the government, de facto authorities, and other armed groups across the country, the report states. They include arbitrary detention, torture and ill treatment, sexual and gender-based violence, enforced disappearance, and abduction. The report paints an alarming picture of the suffering of returnees, in particular women, amid the increasing number of deportations of Syrians from other countries. The situation of these returnees raises serious questions about the commitment of states to due process and non-refoulement. The report says that women returnees face specifically discriminatory restrictions on their liberty to move freely and independently. It also documents a number of cases of women being forced by male family members to return to Syria to assess the conditions for safe and sustainable return for the rest of the family. Economic hardship, abuse, increasingly hostile speech and rhetoric against refugees, raids and mass arrests in some host countries have compelled many to return to Syria, the report says. Turkey announced in May 2022 what it called the resettlement of 1 million Syrian refugees back to Syria, with reports of increased restrictions and forced deportations. In Lebanon, following months of increasing tensions and animosity towards Syrian refugees, Lebanese security forces conducted more than 70 raids targeting Syrian refugee communities in camps and residential areas across the country in the spring of 2023. At least 1,455 Syrians were arrested and 712 of them deported. There are reasonable grounds to believe that the overall conditions in Syria do not permit safe, dignified and sustainable returns of Syrian refugees to their home country, the report says. It also notes that most of the interviewees said they had decided to flee again, even though once back abroad, it was likely they would face precarious economic conditions and harassment. There are more details in the full press release that we've issued and, of course, in the report that is attached. Thank you.
Thank you, Liz. Do we have questions for Liz on Syria? No, I don't see that's the case. It was very comprehensive. So let's move to the next subject, Senegal.
Of the presidential election slated for the 25th of February. Following reports of unnecessary and disproportionate use of force against protesters and restrictions on civic space, we call on the authorities to ensure that they uphold Senegal's long-held tradition of democracy and respect for human rights. At least 3 young men were killed during protests, and at least 266 people have reportedly been arrested across the country, including journalists. Investigations into the killings must be prompt, thorough, and independently conducted, and those found responsible must be held to account. The authorities should also ensure due process for individuals arrested during the protests. Amid rising tensions and reports of planned further protests, it's crucial that the authorities unequivocally order the security forces to respect and ensure human rights, including the rights to freedom of expression, association, and peaceful assembly. We also urge all actors to refrain from resorting to violence. Given challenges and concerns related to the circumstances surrounding the postponement of the election, UN High Commissioner for Human Rights, Volker Turk, calls on the government to ensure that the proposed national dialogue be as broad-based as possible and ensure genuine participation of opposition groups, women, youth, and marginalised groups. Thank you.
Thank you very much, Liz. We have a couple of questions. We'll start with Dina of APTN. Dina, over to you.
Yes, good morning. Thank you, Ronaldo. Actually, my question is about the northeastern part of Syria. After 1 year on the earthquake, how is the situation there? Are people able to survive? Are they receiving aid? Please, can you give us a general idea about this? Thank you.
Yes, indeed. With regard, sorry about, I was just being told something about the microphone that was not on. Your question is about northeast Syria, about the situation. I mean, I think obviously there's issues in northeast Syria. What this report that our colleagues have put together and have put out is really stressing is of course the situation that is faced by all Syrians, but returnees are particularly vulnerable, and one of well, there are many issues there, but one of them, of course, is the situation of conflict and violence. Although the conflict has decreased in some parts of Syria somewhat, there's also the economic situation, which is so difficult. I think what is really important to stress is that over the past few weeks, we've seen an intensification of attacks in Syria. We've also seen this escalation taking place in the context of weeks of growing tension and armed activities between third states and non-state armed groups present on the Syrian soil. And that's also indicating a potential spillover of the conflict in Gaza and the tension in the region. So I think what we're really stressing is the report itself is focused on returnees and the challenges they face, both going back to Syria and then also for the people who are in other countries or may feel that they have to go back to other countries. But the overall situation is, of course, incredibly worrying, and the overall picture, which is described in the report as bleak by some of the people our colleagues spoke to, is very worrying. So that's why we're highlighting it and painting this overall picture of the difficulties faced by returnees, but also in the wider context of Syria today, some 13 years after the crisis started and the conflict ensued. Thank you.
Thank you very much, Liz. I will ask those putting their hands up if this is on Syria, maybe Lisa, or if there are any colleagues who want to ask on Syria. Let's just exhaust this subject first. Lisa?
No, it's on Senegal, so see if you can exhaust
that's
it
fine.
elsewhere.
In fact, I think maybe Dina has a follow-up on Syria. I see your hand is back up, so back to you, Dina.
Yes, thank you, Ronaldo. My question is about the Israeli attacks on Syria. We saw this repetitively this year and last year, and recently the US attacks on several spots. Do you mention anything about this in your report, please, Liz? Thank you.
The report itself, as I've said, is looking at the situation of returnees. So it's based on a number of interviews done with returnees, both inside Syria. As you may know, that we're not actually physically present in Syria, although we do have a team with focus on Syria. So a range of interviews with returnees, both based in Syria, but also some that may have then left Syria after initially returning. I think, as I've said, what is the background to this is of course that we have seen an intensification of attacks on Syrian soil over the past few weeks. These have included Iranian-backed armed groups present in Syria, as well as third states such as Israel and the US. So as I said in response to an earlier question, we are concerned because this escalation is taking place amid growing tensions and armed activities in the region, and of course the concern, as I've said, of a potential spillover of the conflict in Gaza and the tension in the region and onto the Syrian conflict. Thank you.
Thanks, Liz. I think Catherine has a question on Syria as well, so back to you, Kat.
Thank you, Rolando. Good morning, Liz. My question is regarding all what is in the report, and you just mentioned. Would you say that it is not safe for refugees, Syrian refugees, to return to Syria? That's my question.
Yes, understood. Very clear. I mean, I think, as I don't know if you've had a chance to actually look at the report, which details it, but one of the main sort of findings, as it were, of the report is indeed there are reasonable grounds to believe that the overall conditions in Syria still do not permit safe, dignified and sustainable returns of Syrian refugees to their home country. And then, of course, this is really important to stress, any envisaged return should be voluntary based on case-by-case assessment of the conditions for a safe, dignified and sustainable return.
Thanks again. Okay, I think we will now turn to Senegal, but before we do so, I think maybe in the interest of having the clear audio, I think maybe you might want to read the statement over again. So if you can indulge us, colleagues.
Yeah, absolutely. Sorry about that. I thought I had pressed the microphone, but clearly it wasn't on. So if you could bear with me while I read it again, because obviously it is incredibly important. We are deeply concerned about the tense situation in Senegal following suspension of the presidential election that was slated for the 25th of February. Following reports of unnecessary and disproportionate use of force against protesters and restrictions on civic space, we call on the authorities to ensure that they uphold Senegal's long-held tradition of democracy and respect for human rights. At least 3 young men were killed during protests, and at least 266 people have reportedly been arrested across the country, including journalists. Investigations into the killings must be prompt, thorough, and independently conducted, and those found responsible must be held to account. The authorities should also ensure due process for individuals arrested during the protests. Amid rising tensions and reports of planned further protests, it's crucial that the authorities unequivocally order the security forces to respect and ensure human rights, including the rights to freedom of expression, association, and peaceful assembly. We also urge all actors to refrain from resorting to violence. Given the challenges and concerns related to the circumstances surrounding the postponement of the election, UN High Commissioner for Human Rights Volker Turk calls on the government to ensure that the proposed national dialogue be as broad-based as possible and ensure genuine participation of opposition groups, women, youth, and marginalised groups. So thank you. Apologies for having to read it again, but as I said, very important story. So hopefully the recording will be okay now.
Indeed, very important. So we'll now take questions on Senegal. Lisa?
Yeah, I have questions on Senegal, but you said something when you answered the question on Syria. Can I ask a question first about Syria and then get on to Senegal? Sorry.
Okay, we'll keep it in the order then. If you can ask your question quickly on Syria, then maybe in the same,
very quickly.
and also Senegal in the same.
Okay, you were talking about your fear of what is happening in Syria being a spillover into Gaza. If you could elaborate upon that, what is it that you mean? And then I'll ask you a question about Senegal. Okay, thank you.
Well, I think there are concerns about the spillover of the Gaza conflict into the wider region. But if we think specifically about Syria, this is a country, as I said, that has endured some 13 years of crisis and conflict. And the report itself sets out in detail the challenges that are faced by Syrians, and among them the returnees. I think that's why we are so concerned, precisely because of the situation in Syria. The fact that people are facing a host of challenges, be they security related, be they economic, be they human rights violations and abuses. So Syria was so often in the headlines. It's much less so now. But of course, over the years, we have seen the toll of conflict on Syrians, on the country. And of course, we are really concerned about any flare-up. There is conflict taking part in some parts of the country. We are concerned indeed about the spillover into Syria and of course in other parts of the region.
Thank you very much, Liz. Okay, and back to you, Lisa, for a question on Senegal now. Go ahead.
Yeah. Got it on Senegal. Yeah. The situation in Senegal seems to be deteriorating rapidly. It started out with largely peaceful demonstrations. Now you have reported, I think, the first deaths that have occurred. What are your concerns? Are you afraid that this might actually get out of control and turn into a huge emergency? And I'm wondering whether the High Commissioner himself or other representatives in your office have been in direct contact with the authorities about the situation and about toning down what is happening. And if so, if there has been any kind of a response or anything that you believe that indicates that maybe the authorities are listening to the people. Thank you.
Thank you, Lisa. That is an important and quite wide-ranging question. I think if I may take it sort of in stages. I mean, first of all, we're concerned by the circumstances that led to the postponement of the elections that were scheduled to take place on the 25th of this month. And so our broader concern there is any decision to postpone elections should be based on broad-based consultations to ensure inclusion and political consensus and to preserve democracy. Now, moving on to the specific situation within Senegal, as we said, that at least 3 young men were killed during protests. We are concerned by reports that protests against the postponement have been met with unnecessary force. The signal of a leading TV channel has been cut off and access to the internet restricted. So that's why we've made this call on the authorities to uphold human rights, including the right to access information, freedom of expression and peaceful assembly, consistent with Senegal's human rights obligations. This is something that we stress repeatedly. It's essential that any restrictions imposed on access to information and freedom of expression, including through broadcast suspensions and internet restrictions, are in pursuit of a legitimate aim under international law. And they need to be strictly limited to what's necessary and proportionate to accomplish a legitimate aim expressly spelt out in law. You're asking about contacts with the authorities. Well, yes, indeed, we are in contact with the authorities. We do have a regional office based in Senegal. So this is something that the office obviously has been taken up with the authorities. And that is why we've putting this out today. As the High Commissioner is saying, there are challenges and concerns related to the circumstances that led to the elections being postponed. And that's why he's calling on the government to ensure that the proposed national dialogue be as broad-based as possible. And it's really key to ensure genuine participation of a whole range of people, opposition groups, women, young people and marginalised groups. Thank you.
Thank you very much, Liz. And maybe just needless to say, the Secretary General, Antonio Guterres, is following the situation in Senegal very closely. He issued a statement on Friday, which we did share with you Friday afternoon, through which he urges national stakeholders to engage in dialogue, to uphold a peaceful political environment, to refrain from the use of violence, and to ensure the holding of an inclusive and transparent presidential election within the framework of the Senegalese constitution. That statement was shared with you on Friday evening. And yes, from AFP.
Yes, hi everybody. Thank you for taking my question on Senegal. Liz, you mentioned that you are in discussion with the authorities through your regional office. And so far, what have been the answers of the authorities? And today there is a shutdown of the mobile internet there. So I wanted to ask you, how do you think this could affect the situation in general? And yes.
Yes, thank you for those two questions. Yeah, we are in contact with the authorities. I mean, we're as per usual, we're not going to say what the authorities have said to us, but just to stress that we are in contact with them. With regard to the shutdown of the mobile networks, the internet that I alluded to, yes, I mean, we are concerned. As I said, I read out our sort of general position. It is really important to guarantee the right to access to information. So any restrictions that on access to information, be it sort of cutting the internet, cutting mobile systems, should be really pursuing a legitimate aim under international law, and be strictly limited to what's necessary, and that includes being as limited as possible in time. Thank you.
Thank you, Liz. Emma of Reuters.
Thanks. I'm sorry, it's back to Syria. Sorry to jump back. I was just wondering, Liz, given the dangers that Syrian returnees are facing, do you have a message for governments who may be pressuring them to go back? And are you concerned about this? And maybe UNHCR might be able to jump in to give us the picture of how many Syrian refugees are still in the world and maybe in Europe, and what portion of them have gone back? and if they're concerned about this as well? Thank you very much.
Thank you, Emma. I think the report, as I was saying, it has two elements. It focuses on the people who fled Syria and then returned. And they may have returned for a number of reasons. It may have been the economic situation in the country that they had fled to. It may be that they felt pressured. There has been, in some cases, a hostile environment, rhetoric. They may have felt that they needed to return. So that is one element of the report. The other element is, of course, what happens to the people once they're back in Syria. And our report details the numerous challenges they face and of course, the human rights violations and abuses that they may also face. And that's why some of the returnees, in fact, I think many of the returnees that our colleagues spoke to, they said that they were considering trying to leave Syria again. So that really it's the two sides to it. So very difficult situation for some of the people who fled and therefore they want to return or they return. And then, of course, a very difficult situation of the people who go back to Syria and what they encounter there. There are some numbers in the report, but of course they are UNHCR's numbers because they really are the ones that have the details. And I know that their data portals and their website has very detailed figures on the latest. So I will give you a ballpark figure, but of course, I would encourage you to reach out to UNHCR and also look at their data portal. That about sort of 6.7 million left, and then the figures that we have. But I think my colleagues from UNHCR would update it. About 388,000 as of November 23 had returned from neighbouring countries. But I'll leave it to UNHCR to go into the data.
That's very helpful, Liz. Thank you. Yeah, we do have Eugene, our colleague from UNHCR, who's online and could add. Over to you, Eugene.
Hi. I hope you can
Go ahead, please.
hear me. Okay. So according to our data, that it's just a note that this is a monitored one strictly that we have at the moment is that I will just have a look, and then just please note that over 5.1 billion Syrian refugee as of 31st of December 2023 is most of them are staying in neighboring country. Of course, the Turkey is the country that hosting the most of Syrian refugee, 3.2 million, and then strictly talking about the refugee returnees from 2016 to last year December, that we monitor that 391,000 Syrian refugee returned to their country, and 2023 alone, then 37,000 returnees. But please note that this is a monitor number, so the actual number might be even bigger than what we have at the moment. Thanks.
Thanks for jumping in, Eugene. If you'd be so kind as to send those figures by email to our colleagues, that would be most helpful. Lisa, you have a question? Go ahead, over to you.
No, sorry, I mistook my hand, sorry.
That's fine, you're forgiven, things happen. Any further questions on either Syria or Senegal? No, in that case, we can turn to the next subject from human rights, business and human rights. So over to you, Liz.
Yes, thank you, Rolando. Indeed, this is about business and human rights. We've issued a press release this morning from the High Commissioner. UN High Commissioner for Human Rights Volker Turk on Tuesday urged EU leaders to approve a groundbreaking agreement on business and human rights, amid reports that support for the measure may now be in question in the European Council. The High Commissioner is stressing that the adoption of the directive, it's called the Corporate Sustainability Due Diligence Directive, would show historic leadership by the EU at a time when global leadership in support of human rights is needed more than ever. For the past 4 years, work on the directive has seen unprecedented involvement by many stakeholders, including business and by the UN Human Rights Office, as well as political commitment from EU institutions and member states to push it forward. This process has really raised hopes of ensuring more effective management of human rights risks by large companies. So for the directive to fail now would be a massive blow. The EU-wide directive would require certain large EU and non-EU companies to identify and address adverse human rights risks. Human rights due diligence is feasible and supports sustainable business processes that deliver long-term value to society at large. And for that reason, or for those reasons, it makes eminent business sense. Many of the companies that would fall within the directive scope have backed its adoption. The agreement on the directive is reported to be substantially aligned with the UN guiding principles on business and human rights and other relevant international human rights standards. The High Commissioner says in his press release that he's convinced that the directive can make a positive contribution to respect for human rights. Its adoption would send an important message of solidarity to those at risk from business activities. We understand a vote on the directive is possibly due later this week. So the call from the High Commissioner to EU member states is to demonstrate principled leadership on this landmark piece of legislation and bring it across the finishing line. Thank you.
Thanks to you, Liz, and thanks for having shared that press release. Questions on business and human rights for Liz? Gabriela, Gabby, El Proceso, over to you.
Yes, thank you so much, Rolando. But I have a question on another issue, if possible.
What is the issue then?
It's about Venezuela.
Is it for Liz?
Yes.
Okay, maybe in the interest, since we can, we have other briefers, we'll take your question now on human rights. Go ahead on Venezuela.
Yes, it's about the forced disappearance or arbitrary detention of Venezuelan activist Rocío San Miguel, president of the NGO Control Ciudadano. San Miguel was detained on Friday at the Maiquetía International Airport near Caracas with her daughter. But her daughter and I think her brothers, her father, everybody is detained, her family. So if Liz is following, your office is following this case, and what can you say about this? Thank you so much.
Thank you, Gabriela. Yes, indeed. We are aware of this. We are following up on the detention of the human rights defender, Rocío San Miguel, with deep concern. As you're saying, her whereabouts remain unknown, therefore qualifying her detention as an enforced disappearance. We urge her immediate release and respect for her right to legal defense.
Thanks very much, Liz. Further questions for Liz before we release her? No, I don't see that's the case. So thank you once again, as always, for joining us here. Very pleased to introduce our colleagues here. Joining me on the podium, we have Hervé Husel, of course, you know, from UNITAID. And joining me to my left is Dr. Prebo Barango, who is a cross-cutting specialist on non-communicable diseases and special initiatives at the WHO. And they're going to address global action on cervical cancer. So maybe, Hervé, do you want to start off?
Yes, thank you. And we understand it's a busy briefing. We'll try to be not too long. I'm here today to speak on behalf of a coalition of 11 partners, the government of Colombia, the government of Spain, the Pan American Health Organization, the World Health Organization, UNICEF, the Bill and Melinda Gates Foundation, UNITAID, the Global Financing Facility, Gavi, the United States Agency for International Development, and the World Bank. A woman somewhere in the world dies of cervical cancer roughly every 2 minutes. It is the fourth more common cancer among women worldwide. It is also one of the few types of cancer that can be prevented by a vaccine. Vaccination against human papillomavirus, the leading cause of cervical cancer, together with screening and treatment, is a proven path to elimination. Yet, due to supply constraints, delivery challenges, and the pandemic, just 1 in 5 girls have been vaccinated. Cost-effective and evidence-based virus screening and treatments is also critical to saving life, but inequities remain too high. Fewer than 5% of women in low and middle-income countries are ever screened for cervical cancer. And an estimated 348,000 women who died of cervical cancer in 2020, 90% of them are coming from low and middle-income countries. Major progress can be made by integrating cervical cancer services in existing primary healthcare delivery. We have cost-effective and evidence-based tools for screening and treatment. The WHO recommendation of 1-dose HPV vaccine opens new opportunities to reach more girls worldwide and will significantly reduce cost and logistical barrier. But at the status quo, annual deaths from cervical cancer will likely reach 410,000 by 2030 if we don't change course. Instead, if we make the right commitments, we can eliminate for the first time ever a full category of cancer globally. That's why 11 co-hosts will organize the first ever global cervical cancer elimination forum the first week of March in Cartagena de Indias, Colombia. The forum will bring together senior ministry officials with leading global health development agencies, donors, academia, and others to galvanize the global movement to eliminate cervical cancer. New and ambitious commitments will be announced, financial, policy, and programmatic, to advance the cervical cancer elimination agenda. The forum offers a moment for the world to collectively accelerate progress on a groundbreaking promise made in 2020, when nearly 200 countries signed on the WHO global strategy to eliminate cervical cancer worldwide. This set out 3 clear targets to meet by 2030 in order to put countries on the path to eliminations. Very quickly, that's 90% of girls vaccinated by age 15, 70% of women screened by high-performance test by age 35, and once again at 45, and 90% of women with cervical disease receiving treatments. Now it's the time for government and international organizations to step up and to prioritize the fight against cervical cancer. And that's why those 11 important partners are stepping up and hosting that important forum at the beginning of March. And I would like to introduce Dr. Prebo Barango, a specialist at the WHO. We will briefly develop the subject.
Thank you very much, Javier. Cervical cancer, like has been mentioned, is the 4th most common cancer in women globally. But we know that in 25 countries in the African region, cervical cancer is the #1 cancer that affects women. And in places where cervical cancer is the most common cancer, it actually demonstrates the inequities in access as well as social and economic depravities. So for the first time, like Heather mentioned, the global community adopted the WHO strategy for elimination of cervical cancer as a public health problem. And through those targets of vaccinating girls of 15 years by HPV, and screening women, eligible women by age 35 and 45, as well as having access to treatment for 90% of this. We know that if this can be achieved by 2030, it will put countries on the pathway towards elimination. Now, Javier has eloquently highlighted the opportunities that there are for vaccination, for screening and treatment. But we know it is not an either-or approach. The 3 of vaccinating girls, of screening women, and ensuring that those that are detected with disease are treated early will be needed to make sure that countries are on the track towards elimination of cervical cancer. To do this, We also know that access to screening has been very, very low. Most countries, especially low and middle income countries, have low coverage for screening. For this, WHO has also released guidelines to ensure that cervical cancer screening is cost effective. So the HPV DNA testing has been recommended, but the uptake of this has been quite low. With support from our partner United, we have actually been supporting countries to ensure that the cost of this, because the cost of HPV DNA testing is a significant barrier. We've been supporting low and middle income countries to be able to improve access to using these technologies for screening and ensuring that treatment is on. So that's on screening. And we also recommend strengthening capacity for treatment, because it is not just screening, but ensuring that capacities for treatment is available. And we know that in low and middle income countries, access to cancer treatment is an issue. The report that WHO released on World Cancer Day shows the inequities in access to treatment for cancers. They are not on the UHP benefit package in most low and middle income countries. So it's a combination of that package that we are here to ensure that countries are able to make commitments towards eliminating cervical cancer as a public health problem. Thank you.
Thank you, Doctor. I just want to add that for the 11 co-hosts, that's really the opportunity, the first week of March, to put this on the agenda. That's a real problem, a problem that we need to face because we have all the tools to do so. Then we need political leadership. Obviously, we need money. We have already on the technical part all what we need to do so. Then that's the call of today for the 11 organizations. And thanks to welcome us.
Thank you both very much. Very important messages indeed. Questions for our colleagues? No, yeah, Lisa Schlein, Voice of America. Lisa.
Yeah. Hi, Hervé. Nice to see you. Yeah, I don't understand, what are the supply constraints that you're talking about? And also you say that this is a cost-effective treatment. What does that mean in terms of money? How much money is there? And I don't know, the thing that kind of bothers me, or I can't quite understand, is why, if it is cost effective and it is so effective in terms of preventing these young girls and then women from getting this awful disease, why this isn't happening. Is there not enough publicity? Do the governments do not understand this? Or does it have something to do with the fact that you're dealing with girls? Sorry, but discrimination does exist, and not boys, because cancer treatments have been notorious in terms of favoring the male species. Thank you.
Thank you. I will leave my colleagues developing that. I just want to point out that in terms of price, for example, for HPV tests, together with our partners, United has secured agreements to have a reduced price for those tests by nearly 40%. And in terms of what we call the thermal ablation device, United and partners have negotiated a reduction in 45% of the price of those devices. But I leave Dr. Prebo developing your question.
Thank you very much. So with regards to the constraints with HPV vaccine, one of the key is that the girls, the recommended age range of 9 to 14 years fall outside the normal vaccination for children. So it needs to, they are a unique group. And we know that during COVID-19, there was a significant drop even in uptake of these vaccines because schools were closed. If they were using school-based approach for vaccinating these girls, schools were closed. And we know that also during COVID-19, most facilities were repurposed to be able to to attend to the to the emergencies. So because of that, we saw a significant drop in vaccination for HPV. It's picking up now. So that's one of the challenges. The second challenge is that initially it was 2 doses of HPV vaccines to be given to girls. That was the recommendation. But WHO's strategic advisory group on immunization, the SAGE, has recommended and found out that 1 dose is not inferior to 2 doses. So far, 37 countries have migrated to the 1 dose schedule. Makes it easier. It reduces cost of vaccination, and it also improves access to vaccine. So that's the strategy that's been being used. Now, in terms of the screening, the same issues that affect health systems weakness in most low and middle income countries where cervical cancer is the most common preventable cause of cancer mortality still underplayed. So lack of awareness or lack of access or lack of capacity of the healthcare workers to be able to carry out this simple screening test, or even when they have the capacity, probably the technology is not there. So those are all challenges that account for the low coverage rates we are seeing. And so one of the reasons why we are having this this forum is to make sure that partners, governments, and civil society organizations are able to ramp up community awareness, involvement of the communities to be able to advocate and raise awareness. Of course, you are also aware that there are also misconceptions and on both on the vaccine and on the screening. So it's a total package that will be needed to be able to ensure that vaccination and screening coverage is improved.
That's an important message. And yesterday you received from Kyle and myself a lot of additional technical information in the course of this briefing. Back to you.
Thank you both very, very much. Mr. Dr. Barango, and of course, Hervé for joining us here. I don't see any further questions. So, of course, media, this is a very important role for you to raise awareness about this important situation. So thank you once again for joining us here at this press briefing. Jean Rodriguez of UNEC, UN Economic Commission for Europe, has an announcement on an upcoming the Inland Transport Committee beginning next week. Over to you, Jean.
Thank you, Rolando.
Yes, go ahead.
Bonjour à tous. La semaine prochaine sera marquée sur le signe de transport pour la CEE. We will be hosting our 86th annual session of the Inland Transport Committee, which is the UN regulatory platform for inland transport, which covers road, rail, inland waterways, and intermodal transport as well. So ITC is the equivalent of ICAO for air, civil aviation, and IMO for maritime transport. It gathers delegates not only from our 56 member states, but delegates of the 152 UN member states, which are parties to at least one of the 60 international transport agreements under the purview of the committee. We expect over 20 ministers and deputy ministers from our region and beyond, including from the Netherlands, the US, the Russian Federation, Ukraine, Tajikistan, Uzbekistan, as well as Iran, Laos, PDR, Lebanon, Morocco, Nigeria, Qatar, Saudi Arabia, and Peru. The session is called to adopt a strategy to decarbonize inland transport by 2050. Let me recall that the transport sector is responsible for some 23% of global greenhouse gas emissions, with road transport alone accounting for around 77% of these. With the estimated increase of population, economies, and the need for mobility over the coming decades, the World Bank estimates that greenhouse gas emissions from transport could increase by as much as 60% by 2050 if left unchecked. So clearly, the strategy to be adopted next week will be very crucial to make sure or at least to try, that member states comply with their obligations under the Paris Agreement. To get on track with net zero emission scenarios by 2050, CO2 emissions from the transport sector must fall by more than 3% per year by 2030. The objective of the strategy that is expected to be adopted next week is to set a medium and long-term course towards the goal of carbon neutrality by 2050, enabling parties to deliver on their climate commitments. The strategy also encompasses shifting to low carbon transport modes and moving freight and passenger from road to rail and inland waterways. In addition to climate change, the session will see the opening for signature of the Convention on the Contract for International Carriage of Goods by Rail that was adopted last November. The convention aims at unifying the legal system for the carriage of goods, of cargo, and facilitate rail freight between Europe and Asia. The session will also feature several high-level events, notably the ITC Forum for Road Safety and roundtables on digital and green, as well as a ministerial side event on the SPECA roadmap for the digitalization of multimodal data along the Trans-Caspian Transport Corridor, which is a corridor linking Asia and Europe through Central Asia and the Caucasus. So we'll send you the details and stand ready to answer questions if you have any. Thank you.
Thank you very much, Jean. Merci beaucoup. Do we have questions for Jean? No, I don't see that's the question, the issue. So I thank you very much once again. Appreciate you briefing us on this committee, and good luck next week. Before we close, I just have a couple of announcements, but firstly, just to mention that as regards the press stakeout with Mr. Lazzarini, it's running a little late, maybe 10, 15 minutes from now. It is being webcast live, so you could go to webtv.un.org and find it in this schedule. Should start in maybe around 10 minutes or so. Just to mention, we have a couple of committees in session this week. The Committee on Elimination of Discrimination Against Women, CEDAW, is today concluding its observations of the this coming Friday, it will conclude its session, at which time it will issue its concluding observations for Niger, Tajikistan, Italy, Turkmenistan, Greece, Oman, Djibouti, and the Central African Republic. That's this Friday. And the Committee on the Economic, Social, and Cultural Rights yesterday opened its 75th session, and today it's reviewing. One moment. This afternoon, it will continue its review of Mauritania, according to my notes. And last note is a festive one, I should say. There's a concert this coming Thursday, the 15th of February. It's you may be familiar with the Antigel concert series. There's an Antigel concert taking place here at the Palais des Nations this coming Thursday, the 15th of February at 8 p.m. in room 20. This is hosted by the UN Research Institute for Social Development, UNRWA, together with the UNOG, the UN office at Geneva. And they've joined forces with Shap Shap, which is a local non-profit focused on fighting global inequality and racial and gender-based discrimination through cultural projects. So we have a number of artists, including Colombian Afro-Indigenous artist Lido Pimienta, who will be performing this Friday. If you want to register, you could find a link on Indico, or better yet, you can contact our colleague at UNRWA, Karima Sharif, KARIMA.CHERIF@UN.org to register your interest and attend this nice event this Thursday. That's it for me. Any questions? On that note, have a good afternoon.